Yeah, these are enterprise organizations. They're often the biggest employers in each of their cities in terms of the
Yeah.
number of workers that they employ. And healthcare is the biggest labor sector in the country by number of workers. I think what we discovered led to the creation of Incredible Health is we knew that healthcare was the biggest labor sector in the country. We also knew there were massive shortages. Has the biggest labor shortages in the country. Put it in context, we're on track to be 1 million nurses short by the end of this year. So that's a lot of missing nurses, and that's just with nursing, let alone the other healthcare professions. In 20 years, post a
Yeah.
job and hope it all works out. And we found that that just was very insufficient for both the hospitals, and it was also just creating a very weak experience for the talent.
Yeah.
When you speak to nurses, you often hear them say, "Hey, I applied to 10 places, I didn't even hear back. If I
Yeah.
heard back, it took 2 or 3 months to get my next
Yeah.
job," and that's just not how it should work.
Yeah.
And look, many things in healthcare are like this, right? Like it's just
Yeah.
an industry that's a little bit behind the ball when it comes to operational excellence and adopting the latest and greatest technology and really just driving that focus internally.
What did you see were the shortcomings of the technology? Was it the compliance piece? Was it adopting on a mass scale? Was it the actual pieces of technology that were the incumbents? What did you see was really where the process halted or stopped or had barriers?
Yeah. So, I mean, speaking in more general terms, like why is healthcare behind other industries?
Mm.
I think there's probably a couple factors. One is like it is a regulated industry, so there is more compliance to consider and more regulation to consider. Not that different from, say, the finance industry, which also has a lot of regulation and compliance and is also slower to adopt technology too. But then the other factor in healthcare is that the way the payments flow in healthcare and the way incentives are set up in healthcare are quite convoluted and very
Yeah.
different from they're not as straightforward as like buyer and seller in other
Right.
markets. Take e-commerce, it's quite straightforward who the buyer is, who the seller is. Whereas in healthcare, you can have an employer be paying or an insurance company's paying, and that's going to the provider. The provider has to bill an insurance company. The patient is not necessarily paying directly, but they're receiving the service. Like it's
Yeah.
very complicated. It's very complicated how all the money flows.
Yeah.
And so that by having more convoluted incentives, it doesn't necessarily align everyone to operate with the most amount of operational efficiency.
Curious,
Yeah.
in your perspective, is it that we are constrained on the amount of people who are in the industry, or is it connecting those people and in an efficient way? Whereas maybe one hospital is, say, overstaffed and has resources, and then individuals can go somewhere else to shifts or be a part of another organization. Is that part of it? How much of it is in actual people shortage versus a connection problem?
Yeah, that's a great question. The truth, it's both, right? So we have an underlying supply shortage where healthcare has the biggest labor shortages. Like we as a country continue to increase demand on our healthcare system because our
Yeah.
population is growing and is aging. And so that's putting more and more in demand on the US healthcare system. Us collectively as a society
Yeah.
have not done a great job over the last few decades to increase the number of healthcare workers to meet that demand.
Yeah.
And so we're behind. Then, in addition to that, there's an inefficiency problem that the talent that is available and the employers that are available are not finding themselves as efficiently as they should.